Hi, today I'll be speaking to you on the risk factors for the development of postnatal depression. I get a lot of people ask me, what are the causes of postnatal depression? Today it's a brief overview on the causes and the possible risk factors for the development of PND. However, before I continue, I also keep getting people ask me, are you a doctor? Are you a medical doctor? And the answer is no, I am not a medical doctor. However, I am a doctoral researcher researching on maximizing the potentials of mobile applications to support women with postnatal depression. Yes, I do a lot of research. The causes of postnatal depression appears to be complex. However, there are risk factors for the development of postnatal depression. The risk of postnatal depression is increased by various support deficiencies, and this can include not having someone to talk openly with, someone that shares similar problem or someone that has had similar problem in the past. Or maybe you feel you lack social intimacy, or you're lacking intimate confidant or friend. You can also get depressed after childbirth if you have had a previous history of depression, or you were depressed during pregnancy. You can also get depression after childbirth when maybe you have difficulties with your partner, difficulties with your family, and you know what it is like when someone you love, you're always arguing, you're always maybe complaining, and you get depressed when it's too much for you. There's an accumulation of stressful life events. If you lack social functioning, there is no practical emotional support for you, there's no support coming from anywhere, it's just you alone, that can lead to postnatal depression. And it's also important for me to point out that the social media plays a very big role in for postnatal depression, especially after childbirth. A lot of women, their expectations are so high, and Facebook, for example, you see pictures of other mothers that you were pregnant together, they're doing well, and that gets at you. And to be honest with you, Facebook is not what you see. Don't believe in what you see all the time. People will only paste the beautiful part of themselves on Facebook. You will never see the bad parts. You will never see the unhappy parts. Trust me. Environmental stressors can be a risk for postnatal depression. Having previous history or having a family history of psychological disorder, mental disorder, or having severe baby blues. And actually, single motherhood is also a risk factor for postnatal depression. Some mother, the burden is just on them. They have to do the cleaning, they have to do the cooking, they have to do the school runs, they have to pay the bills, and sometimes some others might have, or some people might have a negative view of life. And some mothers might have left their employment, and that's really getting at them because the social level is down, it's come down, they're not where they used to be, and that when they begin to think of that, they begin to stress, anxiety begins to set in, and postnatal depression starts knocking on the door. So after childbirth, you need to be careful of these things. You do not need to stress yourself about things that are not worth it. You need to look at your baby, because having a baby is worth it. The baby has eaten from you. The baby has grown up in you, and you should be happy. It's a bundle of joy. You've spent 9 months feeding that baby, 9 months carrying that baby in your hips, in your body. You should be happy, and do not allow these risk factors to set in, and that might lead to postnatal depression. Having said that, you need to ask for help. New mothers, you need to ask for help. After childbirth, it is important that you have enough rest. everyone needs to understand that the new mother has gone through a traumatic experience. Hence, she needs a lot of rest. She needs a lot of love. She needs a lot of support with feeding, with having rest, sleeping, going out. Your social life should not be taken away from you because you've given birth. You should have a social life as well. So you could probably give some, maybe your family, to keep the baby and have a life of your own. You need to know that you need to take care of yourself first for you to be able to take care of the baby. If you are not in a good health, if you're not in a good state of mind, then you cannot take care of the baby. Then the baby reacts to your own feelings, reacts to your own thoughts as well. And that's not good for the baby's development. It is a widely held view that the psychological role transition related to motherhood have been shown to be a risk factor for postnatal depression. And it's also important to note that children of depressed mother are likely to get depressed as well, even if the mother has only experienced a mild episode of depression. Maybe baby blues, that's a mild mental state as well that occurs just a few weeks after childbirth. However, it's worthy to note that if you're depressed, it is not your fault. You need to get support, you need to get help from family, you need to be kind to yourself, and you need to be in a good state of mind. You need to be well to be able to take care of your baby. Get support from your family, from friends. Speak to somebody about how you feel. Speak to your friends, speak to your confidant. Don't feel socially isolated. Believe in yourself, be proud of your bundle of joy. Be proud of yourself because you fed the baby for 9 months. That baby lived in your body for 9 months. You have to be proud of yourself. You have to be proud of what you have done. Don't give up on yourself. There is really nothing you can do about it. It's not your fault that you're depressed. So don't blame yourself. There is nothing you can help it. You can't. And then my advice for whoever fathers that are depressed today is speak to your doctor. It is very important that you speak to your doctor. The moment you see that you're getting depressed, or your partner is getting depressed, or your friend is getting depressed, advise them to go to the doctor. And with that, we can save a new mom's life. We can save a new father's life. We can reduce the number of women that suffer from postnatal depression. We can reduce the number of people that remain with postnatal depression without help. And thank you for watching. Thank you for watching this to the end. If you like the videos and you want more updates on postnatal depression, I want you to subscribe. Don't forget to share the video so that everyone is informed. And let's create awareness of postnatal depression. And I'll see you again. Bye.